Alzheimer's disease impacts a lot of people as the leading cause of disability in older Americans. Touro Family Medicine physician Dr. Meredith Maxwell is here to discuss the symptoms of early onset Alzheimer's and a little bit about what families need to know. Dr. Maxwell, good morning. Let's start here with the basics. What is Alzheimer's?
So Alzheimer's is a disease that affects the brain and the nervous system. It happens when the nerve cells in the brain die, and it's typically progressive or gets worse over time. And unfortunately, doctors don't yet know definitively what causes it. There's still ongoing research, but we have some theories.
Like what?
So certain genes, they think protein possible deposits in the brain. Sometimes, they think environment can be a causative factor, and then immune system problems can also be a causative effect, as well as like if you have it in your family history and your age, the older you get, the more likely this can present. So it's a multifactorial hypothesis.
So that, some of the early symptoms, the memory loss that might affect job skills or some of the short-term memory sorts of things. If somebody is noticing someone in their family who seems to be, developing this, how important is it to get early intervention?
I think
or does it make a difference?
Important. It does, because it's not always, the beginnings of Alzheimer's or dementia. It could be, an infection or something else that, your PCP needs to rule out. We do like a physical exam, we run lab tests, we do something called a mini mental status exam to see exactly what's going on. Depression can present sometimes as kind of a memory loss type of thing. So, it's important to get that rule out, and then if it is Alzheimer's, to get to the right doctor as soon as possible.
So there is no cure. In terms of prevention, I've heard the theory that use it or lose it, like read, be active even in retirement, or even as people age and even into their 50s, make sure that you're learning new things. Does that make a difference?
It does. So there are care programs available for depending on what stage of Alzheimer's you're in, but a balanced program of exercise, social activity is really important. Daily activities that are meaningful and familiar, that give structure and meaning to the person's life. And then, your caregivers kind of, if you need cueing, like if you need them to start something for you, let that patient continue it, because that's important for them and their disease progression. So, definitely not sitting on the couch and becoming stagnant. That's probably the worst thing you can do. So you want to stick to routine, familiarity, activities as much as you can, and these programs can definitely help with that.
I saw you sneak in that exercise thing again, which apparently it's a real thing. Okay, thank you, Dr. Meredith Maxwell from Touro. Thanks as always.